Loprox cream is used to treat fungal skin infections such as athlete's foot, jock itch, and ringworm. It is also used to treat a skin condition known as pityriasis, tinea versicolor, a fungal infection that causes a lightening or darkening of the skin of the neck, chest, arms, or legs. The medication works by stopping the growth of fungus. The recommended dosage and timing for using Loprox cream will depend on the severity of the infection, so it's best to consult with a healthcare professional for the best course of action. This medication is for use on the skin only. Make sure the area to be treated is clean and completely dry. Apply a thin layer of the medication on and around the affected area and gently rub into the skin as directed by your doctor, usually twice daily. Remember to wash your hands after using unless the area being treated includes the hands. Do not wrap, cover, or bandage the area unless directed to do so by your doctor. Avoid applying the medication in the eyes, nose, mouth, or inside the vagina. If the medication gets into these areas, rinse with plenty of water. Use this medication regularly at the same times each day to get the most benefit from it. It's important to continue using this medication for the full time prescribed, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. You should start to see improvement in your condition within the first week of treatment. If your condition worsens or does not improve after 2 weeks for pityriasis or after 4 weeks for other fungal skin infections, make sure to tell your doctor. If you experience burning, redness, or itching at the application site, it's important to let your doctor or pharmacist know. This medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor right away if you notice blistering, swelling, or oozing at the application site or if you experience a very serious allergic reaction. Symptoms of a serious allergic reaction may include rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. If you notice any other effects not listed above, it's important to contact your doctor or pharmacist for guidance. Before using Loprox cream, it is important to inform your doctor or pharmacist of any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It is also important to disclose your medical history to your healthcare provider before using this medication. If you are planning to have surgery, it is important to inform your doctors or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Loprox cream should only be used when clearly needed, and it is important to discuss the risks and benefits with your doctor. It is also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if this medication passes into breast milk. It's important to be aware that Loprox cream may interact with other medications, which could affect how they work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Loprox cream. If this medication is ingested, it can be dangerous. In the event of an overdose with severe symptoms like fainting or difficulty breathing, it is crucial to seek immediate medical attention by calling 911. Alternatively, contact a poison control center right away. In the U.S., you can reach a local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It's important not to share Loprox cream with others, as it has been specifically prescribed for your current condition. Do not use it for another skin infection unless directed by your doctor. If you are using Loprox cream to treat athlete's foot, make sure to wear well-fitting, ventilated shoes and change your socks at least once a day to help with the healing process. If you forget to use Loprox cream at the scheduled time, use it as soon as you remember. But if it's close to the time for the next dose, then just skip the missed dose and continue with your regular schedule. Do not use double the amount to make up for the missed dose. Remember to store Loprox cream at room temperature and away from children and pets. Do not flush it down the toilet or pour it into a drain unless instructed. When the product is expired or no longer needed, make sure to properly discard it. It's always a good idea to consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.